Dr. Jeff is away again today, so I'm Kaitlyn.
I'm Mirela.
And today we're going to talk about common medical terms that have a couple similarities but are actually very different. So first we're going to discuss tendinopathy, tendinitis, and tendinosis. So a tendon is a soft tissue in your body that connects muscle to bone, and these are different conditions that can affect it. So tendinopathy can be used as sort of an umbrella blanket term to talk about any sort of condition that affects a tendon, or it can be used specifically to describe a chronic condition that just won't heal, a tendon condition that won't heal itself. So it can refer to both of these underneath, tendinitis and tendinosis. Tendinitis is less common than tendinosis, but it can actually lead to tendinosis if it doesn't heal. So tendinitis is referring to an acute condition, something that causes inflammation, and it can only take up to several weeks to heal. But if it persists, then it can lead to tendinosis, which is a chronic degeneration of the tendon, and this can take several months to heal. So it can either be as a result of the tendinitis, the acute injury that won't heal, or it can be due to repetitive microtraumas in the tendon that just won't let it heal properly. And common places that you can see some of these conditions will be in the Achilles tendon in your heel or in the biceps tendon in your shoulder here.
So the next thing we will talk about is a sprain versus a strain. So a sprain is a stretching or tearing in your ligaments, which is a connective tissue from one bone to another bone, and a common site for this would be in your ankle or in your knee. And then a strain is a stretching or a tearing in your tendon, which Kaitlyn mentioned previously, that it connects a muscle to a bone. And an example of this would be like straining your low back. So for both a sprain and a strain, common symptoms would include pain at the affected area, limited range of motion, and swelling. But more uniquely, a sprain might include bruising at the affected area, and a strain might include muscle spasms.
So next we're going to talk about the difference between a fracture and a break, and turns out there actually is no difference. A fracture is the same as a break, but you can have different severity to it. So it usually takes 6 to 8 weeks to heal, and it depends. You might have to get surgery to fix it, or you'll get by with just a sling or a cast, crutches, something like that. So typically it's caused by an acute injury, so an accident, sporting event, something like that, or it can be caused by continual stress against the bone, so causing small stress fractures or hairline fractures, or you can have a condition that weakens the bone, like osteoporosis or cancer, and this can lead to being more susceptible to bone breaking as well. So symptoms will include swelling, bleeding, bruising, as well. If you see a bone sticking out, then that probably is a good indication that something's wrong. So to make sure that you keep your bones nice and healthy, you want to make sure you have a good balanced diet and participate in resistance exercise to keep those bones strong.
So the last term we will be discussing is arthritis, and just in general, arthritis means joint inflammation, but there are actually over 200 different types of arthritis. So the two that we will be comparing are osteoarthritis and rheumatoid arthritis, or RA. So osteoarthritis is just the wear and tear on your joints. The cartilage on the ends of your bones breaks down, and this can be caused from age, obesity, or just joint injuries in general, and you'll feel a deep aching pain or stiffness. And rheumatoid arthritis is an autoimmune disease, so your immune system will attack those joints, and it can attack your organs such as your heart or your lungs as well. And the symptoms that you feel will be similar to those of osteoarthritis, but much more severe.
That's all from us today. Hopefully you learned something, and thanks for tuning in.
And if you have any more questions, you can just comment below this video on the Facebook page.
I'm Kaitlyn.
I'm Mirela.
And we've got Dr. Jeff's back while he's away.